Did you know that prostate cancer is the second most common cancer among men worldwide? It's estimated that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Early detection is crucial to improving survival rates, but the unfortunate reality is that many men overlook or dismiss the warning signs. Could you be ignoring some of these early signals? The truth is, the symptoms of prostate cancer can be subtle at first, but they are important clues that should never be ignored. As men age, prostate health becomes an increasingly important concern, but how many of us actually know what to look for when it comes to our prostate? So many men brush off potential issues, assuming they're just part of getting older. Yet knowing the signs can make a critical difference in catching prostate cancer early, when treatment is most effective. Today, we're going to dive deep into the 8 early signs of prostate cancer that you should never ignore. These aren't just random symptoms. They are warning signals from your body that something may be wrong. Understanding these signs could be the key to taking action before it's too late. These early indicators may seem minor at first, something you might dismiss or chalk up to age, but in reality, they could save your life. Throughout this video, we'll walk you through each of these signs and explain why it's so important to pay attention to them. Stay with us to learn how to spot these crucial warning signals. You might just recognize something that could change the course of your health. Sign number 1: changes in urination. One of the first signs that many men notice when something isn't quite right with their prostate is a change in urination. You might find yourself running to the bathroom more often than usual, especially during the night. The urge to go could come on suddenly and feel much stronger than normal, sometimes making it difficult to control. These changes, while seemingly minor, are often an early warning sign that shouldn't be ignored. For many, this becomes a pattern that gradually worsens, leading to increased frequency and urgency. According to the American Cancer Society, about 40% of men with early-stage prostate cancer report changes in urination as one of their first symptoms. This can include frequent trips to the bathroom, weak urine flow, or trouble starting and stopping urination. It's important to note that these symptoms can also be caused by other, less serious issues, such as benign prostate enlargement. However, if you're experiencing these changes along with other signs, it may be time to take a closer look at what's going on. So ask yourself, have you noticed a change in your bathroom habits? Do you find yourself getting up at night more often than you used to? If this has become a regular occurrence, it's time to consult a healthcare professional. Don't brush it off as just aging. It could be a sign that your prostate needs attention. Getting checked early is crucial, as early detection can greatly improve your chances of successful treatment. Sign number 2: painful urination or ejaculation. Another sign to watch for is pain or discomfort during urination or ejaculation. This is a symptom that many men tend to overlook, but it's one of the red flags that should never be ignored. Pain during urination can feel sharp or burning, and it's often a sign that something is wrong with the prostate. While it could be caused by a variety of issues, such as an infection or inflammation, prostate cancer can also cause this kind of discomfort. If you're experiencing this kind of pain, it's important to pay attention and take action. Research shows that pain during ejaculation is a common symptom in men with advanced prostate cancer, though it can appear earlier for some men. A study published in the Journal of Urology found that nearly 25% of men diagnosed with prostate cancer reported experiencing pain during ejaculation in the early stages of the disease. This could indicate that the cancer has spread or is irritating the prostate in a way that causes discomfort during sexual activity. Imagine a man who had been dealing with mild discomfort during urination for a while. At first, it didn't seem like much, just a slight burning sensation. Over time, this discomfort intensified and started to interfere with his ability to urinate comfortably. Then one day, he noticed that ejaculation became painful as well. At first, he chalked it up to stress or a minor issue, thinking it would go away on its own. But as the pain persisted and got worse, he realized this was something he couldn't ignore. After seeing a doctor, he was diagnosed with prostate cancer. What had initially seemed like a small problem turned out to be a critical sign of a serious condition. If you're experiencing any pain during urination or ejaculation, it's crucial not to dismiss it as something minor. While these symptoms may seem small, they could be an indication of an underlying health issue, like prostate cancer. Pain in these areas should always prompt a visit to your healthcare provider. It might be uncomfortable to talk about, but early detection is key to successful treatment. So, if you're noticing this kind of discomfort, don't wait. Schedule an appointment and get checked out. Sign number 3, blood in urine or semen. One of the most alarming signs of prostate cancer is the presence of blood in your urine or semen. If you notice blood in either of these, it should immediately raise a red flag. This kind of bleeding occurs when prostate cancer affects the urinary tract or the seminal fluid. While there are a number of potential causes for blood in these areas, including infections or benign conditions like an enlarged prostate, it's critical not to overlook it, as it could be an early sign of cancer. Research from the National Cancer Institute shows that around 10 to 15% of men with prostate cancer report noticing blood in their urine or semen during the early stages of the disease. The presence of blood in these bodily fluids can result from tumors or lesions on the prostate, which may cause bleeding. This symptom can be particularly troubling because it's often unexpected and hard to ignore, making it one of the most noticeable signs of a potential issue. While blood in semen or urine can also result from less severe conditions, its persistence or recurrence is a sign that medical attention is necessary. Take, for example, a man who began noticing blood in his urine. At first, he didn't think much of it. He thought it might just be from a small irritation or a minor injury, perhaps from strenuous physical activity. But when the blood continued to appear over several days, he started to feel concerned. Still, he brushed it off, assuming it would resolve on its own. It wasn't until the blood appeared in his semen that he decided to seek medical advice. After undergoing tests, he was diagnosed with prostate cancer. Had he acted sooner, he might have caught it earlier and improved his chances for successful treatment. Sign number 4, pain in the lower back, hips or pelvic area. Pain in the lower back, hips or pelvic area is another early sign of prostate cancer that should not be ignored. This type of pain occurs when the cancer spreads to the bones, which is a common progression in advanced stages of the disease. The bones in the lower back and pelvic region are particularly vulnerable to prostate cancer metastasis, leading to localized discomfort or aching. This pain can start off as a dull, mild ache, but can escalate over time, making everyday activities increasingly difficult. Research from the Mayo Clinic highlights that pain in the lower back, hips, or pelvis is often a result of cancer spreading to the bones. In fact, up to 70% of men with prostate cancer report experiencing this type of pain at some point during their diagnosis. The pain might not seem directly linked to prostate cancer at first, especially if it's mild or intermittent. However, if the discomfort continues to worsen or becomes persistent, it's essential to consider it as a possible symptom and get checked. One man shared his experience of what began as a minor twinge in his back. At first, he didn't think much of it. He assumed it was from lifting something heavy or just the result of getting older. But over time, the pain persisted, becoming a dull, nagging ache that didn't go away. It started to interfere with his daily activities. Simple tasks like bending over or sitting for long periods became increasingly uncomfortable. He attributed it to age or maybe poor posture, but as the pain intensified, he realized it wasn't something that would simply go away on its own. After consulting his doctor, he was diagnosed with prostate cancer that had spread to his bones. What seemed like an ordinary back pain turned out to be a crucial warning sign. Today, we've discussed several important warning signs of prostate cancer that you shouldn't overlook. We've covered changes in urination, painful urination or ejaculation, blood in urine or semen, and pain in the lower back, hips, or pelvic area. These symptoms may seem like minor inconveniences at first, but they could be signs of something much more serious. Prostate cancer can often develop silently, with early signs being subtle but critical. By staying vigilant and recognizing these early warning signals, you're giving yourself the best chance for early detection and treatment. Remember, prostate cancer doesn't always present itself with obvious symptoms, which is why it's so important to listen to your body and pay attention to what it's telling you. The earlier you catch these signs, the more treatment options you'll have available, and the better your chances of a positive outcome. Ignoring symptoms or waiting too long to seek help can make the difference between successful treatment and more complicated outcomes. Empower yourself by staying informed and proactive about your health. Knowledge is your first line of defense. If you're noticing any of the symptoms we've talked about today, don't wait. Talk to your doctor as soon as possible. Schedule an appointment, get tested, and take control of your health. Prostate cancer is treatable when caught early, and the sooner you act, the better your chances of successful treatment. Early detection can make all the difference in your quality of life and your future, so don't hesitate to seek professional advice. Stay healthy, take action, and thank you for watching. By staying informed, proactive, and connected to your health, you're taking the right steps towards preventing and treating prostate cancer. Always remember, your health is in your hands.